But I want to talk about some specific tools that we use. We've already talked about reviewing all of third-party information. We've talked about the interview, but our assessment tools are very important for our conclusions that we are able to come to in personal injury cases. I heard an interview today, actually, on the radio of a psychiatrist in Harvard that was making a comment about a recent tragic shooting in Colorado. And so the interviewer on the NPR station was asking the psychiatrist, well, how can you tell if a person is faking mental illness? And it's very interesting that this particular psychiatrist mentioned that he could use his interviewing clinical skills and he could use third-party information, but he said nothing about psychological testing. And even the NPR interviewer asked him, aren't there psychological tests that can help you determine whether somebody is telling the truth or not? And the psychiatrist said, well, there are some, but they're not, there are problems with them. That was his comment. And I would say that, in response to that, that I think our psychological testing now has arrived at a place that it has legitimate reliability, legitimate validity, with many, many studies, and with norm groups that are appropriate to the type of people that we would evaluate with personal injury, that I would say that we are in good standing, having good tests that address, in a reliable way, that address whether a person is malingering symptoms or not. And with personal injury, that is also the case. Now, one of those tests is a common test that's used most frequently, and that's the MMPI-2. And people might be a little taken back that I would say that this common test is one of the best tests to be used, but it truly is. And there has been a recent review of the MMPI-2 and the response, the validity response scales on the MMPI-2, looking at 65 different studies. And there are many, many more studies than that. But basically, the conclusion of this research is that the MMPI-2 and the validity scales are a good way of assessing the probability that somebody is not telling the truth and is malingering in their responses. Now, when you look at the MMPI-2, there are several scales that as a clinician you want to look at. The one scale that is the first scale that you see on any kind of printout of the MMPI-2 is what's called the blank scale or the cannot say scale. And this is just the number of items that they leave blank. And when I'm doing a personal injury evaluation, I look at that because if there are more than 30 items out of the 566 true-false items on the MMPI, if there are more than 30 items that are left blank, that raises an issue of what is happening here, that the person cannot respond to these true-false questions. And sometimes I will sit down with the person and I will go through those unanswered questions. And I will try to find out why they did not answer those, through an interview format, why they did not answer those questions and how they would answer them if they had a chance to answer them again. Now, that gives you a very good impression of maybe why they were guarded and not answering those questions, or were they just skipping items and in a hurry. And you can tell that very quickly by going back and asking them why they did not respond to those items and how they would have responded if they had a chance to do it over again. Then there's what's called the L scale, which is called the lie scale. And it's basically a scale that measures people that are presenting themselves in an unrealistically positive light. Now, that is not much of a concern for us here with personal injury cases, because we're basically more concerned about people that are faking bad or are malingering their symptoms. And with personal injury cases, because there obviously is a direct financial reward that's on the horizon, you must be very concerned about malingering and faking bad. Then there are two scales, though, that are important, that are kind of new to the MMPI in the last several years. And one's called the VRIN scale, and that stands for the Variable Response Inconsistency Scale. Now, basically, this scale is composed of 67 items out of the 566, where they picked one item, and then they picked another item of either the same content or the opposite content. And then they look at how consistent they are on these 67 items in responding appropriately, where they are consistent between the first set and the second set. And so you can see very readily that what they're trying to get at is, did the person really pay attention when they responded to this test? Because if obviously they didn't answer items that were very similar or opposite in the right kind of way, you can tell that they were very inconsistent. Another scale that is very much like that on the MMPI is the trend scale, which stands for the True Response Inconsistency Scale. And again, this is two sets of items where the items are just the opposite in content. And the question is, did they respond in the appropriate way? So if they responded true with one, did they respond false with the other? And again, you get an idea of, are they being consistent? Are they just reading the items very hurriedly? Now, why these two scales are important, and why you should pay attention to these scales when you're doing an evaluation and are assessing malingering or faking with a personal injury client, is that you can look at these two scales and you can look at other scales in combination with this scale. Like a scale we'll talk about here in just a little bit is the F scale, which is very, very important. The F scale is the fake bad scale. And if, for example, your VRIN scale and the TRIN scale shows that the person was consistent in their responding, and then they have a fake bad high scale, then you really begin to see that, well, maybe exaggeration or even malingering is an issue here. But if they're very inconsistent on these two scales, and you have a high F scale, maybe you have a high F scale simply because they just haphazardly responded to the test, and they are not really trying to exaggerate their symptoms. So you must look at the VRIN scale and the trend scale in combination with other scales to basically be able to interpret other scales appropriately. Now, the F scale is a very, very critical scale in assessing malingering, and basically the research to date shows that the F scale is pretty good with post-trauma stress and with depression and with some other kinds of symptoms that are common with trauma patients. It's pretty good on identifying people who are exaggerating their symptoms, are malingering, are very, very defensive in general, or that they really do have substantial psychopathology. And a high scale on the F scale could indicate any of those things. Basically, any kind of score above 79, a T-score, a standard score on the MMPI, anything above 79 on the F scale should really raise the issue of whether this person is being trustworthy and straightforward in reporting their symptoms. And again, there's a great deal of research with many, many studies with patients and with clients that are similar in their circumstances to personal injury cases you would evaluate, so that this scale can be used legitimately, and you can refer to that research when you do your depositions and when you do your testimony and in your reports as well. So again, anything above 79 is a clear indicator that something is going wrong here and that the person is over-reporting their symptoms. Anything above 100 means that they're over-reporting their symptoms to the degree that basically the test cannot be interpreted because it's an invalid test. But between 79 and 100, if you have a personal injury client that scores in that category, you really need to test further for malingering. Also, I might add that contrary to what the expectations might be, in general, people in personal injury cases do not have high F scores on the MMPI. So when you do have someone that has a high F score, you really need to pay attention to it. Now, in the last few years, there have been other scales that have been developed on the MMPI that tries to augment the F scale. One is what's called the FB scale. And this is kind of an interesting scale. The FB scale does the same thing that the F scale does. And the way the F scale was constructed is that they took these 500, well actually they took the first 300 items, first 361 items, And they gave them to both clinical groups and normal groups, and all over the United States. And so the F scale was basically those items where no greater than 10% of the population scored or answered that item in a true response. So it's basically looking at a very infrequent response based upon the norm group responses. Now, recently, to kind of get another F scale that can kind of be used basically in conjunction with the F scale, they've constructed what's called the FB scale, and you get that on your printouts or from the testing service. But the FB scale basically looks at items after item 281. So they look at different items, but they construct it in the same way, so that they look at items that in general normal people and clinical populations do not respond to in a positive way. So you have two scales, the F scale and the FB scale, and you can use them and see if they're consistent. And if, again, they're elevated above 80, then it's probably an indication that some sort of intentional or unintentional even exaggeration is occurring. Now, the K-scale, again, is a scale that measures, another scale in the MMPI that measures fake goods, so we're not that concerned about the K-scale. Now, one of the concerns with the F and the FB scale, the validity scales on the MMPI, one of the concerns with both of those scales is that, again, sometimes people that have gone through trauma, they're not particular people who've gone through trauma. So recently, the test constructors have put together what's called the FP scale, the infrequency psychopathology scale. And it is a scale that is more directed at personal injury cases or cases where people have basically had some sort of trauma in their lives. And so it's more specialized to trauma. But the FP scale is not clearly as well researched as the F scale, and it's still undetermined yet whether the FP scale gives you anything different or more than the F scale. However, there are some people that argue that with trauma patients you should be using the FP scale to identify people that are malingering or exaggerating, and not the F scale, or you should use them in both in combination. So, so you have the F scale and you have the FP scale, and you have the FB scale as a measure of consistency with the F scale. So I don't mean to overwhelm you with all these scales, but these are all very good validity scales that have many, many studies behind them. One other comment about using the MMPI to detect malingering or symptom exaggeration is that a lot of researchers now have focused on using two of the validity scales that we've already talked about in combination, and that's the F scale and the K scale. And they found that if you take the F scale and you subtract the K scale, that if you have a score above 25, that it reliably sorts out people who are malingering versus those who are not malingering, or sorts out people who are exaggerating versus those that are not exaggerating. And so and there's a lot of research being done now on F minus K, but again, if the difference between these two scales are greater than 25, and the first one sort of measures, again, the F scale measures exaggerating in a bad way, whereas K assesses whether people are exaggerating in a positive way, and again, if the difference is 25 or greater, then that, the research shows that that has both sensitivity, that is, it picks out those cases that are true malingerers or true exaggerators, and it has specificity. It doesn't identify those that are false positives. And so the F minus K scale is a very good indicator of malingering or exaggeration. So these are some of the scales on the MMPI, and I want to stress that the MMPI generally is looked at as a broad clinical instrument that identifies personality characteristics or traits like depression or like anxiety or paranoia, and you can use all of those scales as well when it comes to looking at the symptoms, which we'll talk about here in just a little bit. But the validity scales of LUMPI now are viewed as having a great deal of reliability, published reliability, and validity in both picking out true cases and not picking out those cases that are not malingering. So it has specificity and sensitivity as well. And so the LUMPI is kind of the standard right now.